ladies, how are you all doing? Welcome to our taboo topic channel where we talk about female pelvic floor issues, problems and disorders. So today I am going to talk about tight pelvic floor muscles. I know we talk about pelvic floor muscle activation, pelvic floor muscle training, power training, coordination training and endurance training and all that, and at some point it can be overwhelming. And I know women that are so disciplined that they constantly train the pelvic floor muscles, contracting and contracting and contracting, and there is no relaxation. And this is something we always emphasize on, as in train your pelvic floor muscle, contract, but relax it. That is fundamentally important, people. So like I explained to you all our exercises are based on breathing. Breathing is quite important. It's the basics of the pelvic floor training exercises, but the relaxation part is as important as the contraction as well. So I, from experience, have patients that overtrain their pelvic floor muscles and they come back while they were getting better. You're like, okay, now you can do your exercises at home, and please don't forget to relax in between your contractions. You give them the specific instructions, and because they want to get well, they don't mean it badly, they just constantly contracting and they just forget to relax. And after 3-4 weeks, they come back with the incontinence because they cannot voluntarily control the urine, and you're wondering, you were fine actually, what happened? And then after palpating or retesting again, you realize the muscle tone is like as hard as tone. It's like super tense. And then when you talk to them about it, or when I talk to them about it, then they say, oh yeah, maybe we're not relaxing enough and things like that. And then you have to actually come to the relaxation therapy part. And from my years of experience, women can actually learn easier to contract the pelvic floor muscles or to activate it than to actually relax it. But that's how it is. So today we're going to talk about that. Overworking our pelvic floor muscles. What could be some of these signs? Taking time to actually urinate. When we sit on the toilet to urinate, it takes few seconds or a minute or so before the urine could actually come, before the women can actually relax the pelvic floor muscle for the sphincters to open up for the urine to pass through. It takes time. This could be a sign. Gas control. And also painful sex, because of course you all could imagine now when I'm gonna get these organs out. I'll leave the rectum right there. So these are pelvic floor muscles right here, and then when we are having sex and then the penetration here is going through, of course, our muscles, and then we have the deep muscles as well. When all of these muscles are tight, it gets painful when you have the penetration. So painful sex could also be a sign that the pelvic floor muscles are tight. Pelvic region pain. This region you can also have pain, like you have deep pain in your pelvic floor muscles. It's difficult sometimes to explain it, but you just have pain in your pelvic floor area. This could be a sign that the pelvic floor muscles are tight. So these few signs and symptoms you can actually observe, or when you actually have them, please contact your doctor again. They will send you to your physical therapist, and then they would actually evaluate or examine your pelvic floor muscles and then prescribe your ideal therapy for you. So the treatment that we do actually in physical therapy is to try to relax the muscle, try to stretch the muscles. Again, breathing is very important and fundamental in whatever we do in pelvic floor therapy. So breathing in again through your nose, deep in your tummy, and then breathing out through your mouth. Inhale through the nose and exhale through the mouth. And when you inhale, the tummy comes up, and then when you exhale, it goes back down again. So I'm going to show you the rest of the exercises on the mat. So see you on the mat. So we just spoke about pelvic floor tightness and all the things that it can cause. I'm going to show you a few exercises that you can actually do to relax those pelvic floor muscles, to stretch them, to make them flexible, and then reduce also the pain. So we just lie down and you can stretch your legs if you want to, if you could. There are people that always have back pain when they stretch their legs. I always advise them to have something below their knees. So if you have back pain when you lie down on your back straight, you could have something like that, or you could use a pillow or bunch of towels rolled, and then you can put them under your knees. Just lie down on your back and then concentrate on your breathing. Just inhale slowly and deeply. You can stay in this position for a few minutes and then concentrate on your pelvic floor muscles. And then the next position that we're going to use, we are going to bend our knees and we're going to tilt our pelvic region. Just this movement. Just have a look at it. Sometimes I ask people to actually hold those pelvic bones and they can help them do the movements. Good. Repeat this movement like 10 to 15 times and then relax. Then our next exercise would be stretching, opening up the legs, and then stretching it. You could also use your hands. If you find that it's a bit tight, you can gently hold your knees or your thighs and just put a little pressure, gentle pressure, not like to a rough one, but just a gentle slight movement on it or pressure. You can hold it again for 10 seconds or a bit more and then come back. And then repeat again. If you're tight, just do it gently. Stay there until you get it right. We have another position, low squats. You could go like this and try to open it. Some people have difficulties doing that because they're not flexible enough. I always ask them to find towels again or pillows. Basically just sit on them and then try to do the movement. And back again. So those are the few stretches that you can actually do to release or stretch the pelvic floor muscles. There are so many of them, but then again, we show only few. And then if you need more tips, just contact me for your personal coaching or consultation, and I'll gladly help you work on those muscles. Of course, we can also do it manually. The physiotherapist can get into the muscle and then release your pelvic floor muscles if it is very tight, if it is causing troubles or pains, to actually treat that. Until next week, you all have a great time. Bye.